We started the TRAINM Clinic first and foremost to help our son Nathaniel, but also to help as many children and adults with a neurological disorder. Today we are a unique outpatient neurorehabilitation center in the heart of Antwerp, where we treat all neurological disorders, going from MS, Parkinson's, spinal cord injury, cerebral palsy, etc. Our son Nathaniel was diagnosed with cerebral palsy when he was four months old. And starting at that time, my wife and I were looking for ways to help him. We traveled the world looking for robotics manufacturers, technologies that we could use to help him. We actually realized that there is a big void in the market, not just in Belgium, but all over Europe, in that there are very few centers that are focused on post-rehabilitation. So we started this clinic to offer personalized, high-intensity therapies to children and adults who are in the post-rehabilitation phase and really try to bridge that gap.
I worked always in a hospital, like 3-4 years, and sometimes you are stuck with the patient. The patient is also not really motivated anymore because he's always doing the same. And what I experience here in TRAINM is that you can go out of that level where they are stuck. It's really nice to see that the patients are also happy, like finally I'm getting forward. The patients are definitely feeling challenged.
I see a lot of benefits using these devices like the Hocoma. In traditional therapy, I should probably get help from 1 or 2 colleagues to support the patients, then to get the correct movements in the legs. The Hocoma helps taking these extra things over, so we can focus more on like the specific things of the walking pattern and try to get the correct pattern and using the correct muscles in walking.
You have the patient in there, and then you can teach the patient use the correct muscles, and it's not a replacement, it's really an adjustment for the patients and for the therapist.
The results are getting faster. We get more results in a shorter period of time compared to the normal traditional therapy.
90% of our patient population is local, but we have today patients coming from other parts of the world for intensive 1-month therapies. We have one patient from Portugal who is now coming once a month to TRAINM just to keep up with his therapies.
I have MS since my 29, so for quite a long time. From 7 years I go in a wheelchair. The first time I was here, I was for 15 days. After that, I was in holidays, and I was able to walk again for 100 meters maybe, just with my younger son in my side, in the sand. And it was an amazing feeling, because it's amazing walking again.
Basically, all of our therapists are independent, and all of our therapists are specialized in neurophysical therapy, and we do have also one therapist specialized in neuromodulation.
The patient paid the normal physiotherapy fee to us, which is mostly reimbursed, and we can use robots for the therapies, and then the patients, they have to pay an additional fee to the center for actually using the robots.
We are doing everything in our power to try to get reimbursement for robotic therapies. That is also the reason why we started TRAINM Foundation, to help children and adults who don't have the means to come to TRAINM, to help them in their recoveries and help them subsidize their treatments here at TRAINM.
What I enjoy the most here working at TRAINM is the nice environment, and also that the patients are really happy, and especially for me with the children. They can't wait to get in a robot. That's for me the most emotional thing, I think.
We like to treat our patients with dignity. I think it's very important for them to feel good, and it's also very important in their recoveries. Our plans for the future are basically to have a proof of concept of our neurorehabilitation concept here in Antwerp. And once we reach that level, we will expand into other countries, and our vision is basically to become the leading brand in neurorehabilitation in Europe. Our mission is really to maximize the potential of every patient that comes to TRAINM. We really try to strive for maximum recovery.